Right now, more than 8 out of 10 people walking around with early high blood sugar have no idea it is happening. Their body has been dropping hints for years, and almost every one of those hints gets blamed on something else. I am Dr. Hale. In my 15 years in internal medicine, I cannot count the number of people in their 40s and 50s who sat across from me and said the same thing. I feel fine. A little more tired than I used to be, sure. Up to the bathroom once or twice at night, but who isn't? Thirsty a lot lately, but it has been hot. Each of those, on its own, sounds like nothing. Put them in a row, and they can spell out a word your body has been trying to say for a long time. Prediabetes. Here is what should get your attention, even if your last checkup looked fine. The Centers for Disease Control and Prevention estimate that more than 1 in 3 American adults are already in this early stage, where blood sugar is creeping above normal but has not crossed the line into diabetes. More than 1 in 3. And most of them do not know it. This is not a problem that waits for you to turn 70. It builds quietly through your 40s and 50s, often for years, before any single symptom is loud enough to send you to a doctor. So today I am going to walk you through 10 quiet signs that your blood sugar may be creeping too high. We are going to count them down, and I will tell you now, sign number 3 is the one almost everyone gets backwards, and sign number 9 is the one people see in the mirror every single morning and never think twice about. Stay with me to the end, because at the finish I am going to give you the hopeful part, the part most videos skip. This early stage can very often be turned around. It is one of the few warning lights in medicine that you can still switch off. Let me tell you why these signs happen at all, because once you see the mechanism, every one of them clicks into place. Picture insulin as a key. After you eat, your blood fills with sugar from that meal. Insulin is the key that unlocks your cells so the sugar can move out of the blood and inside, where it becomes energy. In the early stage we are talking about, the locks get stiff. Your cells stop answering the key the way they used to. Doctors call that insulin resistance. Your body responds by making more and more keys, pushing harder and harder, and for a while it keeps up. But sugar starts backing up in the blood like water rising behind a slow drain. Every sign on this list is a splash from that rising water. Here is why this ramps up right in your 40s and 50s, and not just later. 2 things happen as we move through midlife. We slowly lose a little muscle each year unless we work to keep it, and muscle is the single biggest place your body parks sugar. Less muscle means fewer parking spots, so more sugar sits in the blood. At the same time, the extra weight many of us carry around the middle after 40 makes those locks even stiffer. So the very decade when people assume they are still fine is often the decade the drain starts to slow. That is why I want you watching for these signs now, in your 40s and 50s, and not waiting for a diagnosis in your 60s. Let me start the countdown. Sign number 10. You are up at night to use the bathroom, more than you used to be. When there is extra sugar in your blood, your kidneys go into cleanup mode. They pull the excess sugar out and flush it into your urine, and water follows it. So you make more urine, and you make it around the clock. People blame their age, their prostate, that last glass of water. Sometimes that is all it is. But a new pattern of getting up 2 and 3 times a night deserves a second look. Sign number 9. You are thirsty in a way that never quite quits. This one is tied to the last. All that extra urine pulls water out of you, so your body sends up the thirst signal to refill the tank. You drink, you make more urine, you get thirsty again. It is a loop. If you find yourself carrying a water bottle everywhere and still feeling dry, that is worth noticing. Sign number 8. You are tired after meals in a way that feels heavier than normal. You eat lunch, and an hour later you could put your head down on the desk. When your cells cannot let sugar in efficiently, The fuel is stuck outside the door. Your blood is full of energy your body cannot reach. Picture a gas station surrounded by cars that cannot get to the pump. Plenty of fuel, no way in. That is the afternoon slump that a strong cup of coffee never quite fixes. Sign number 7. Your vision goes blurry, then clears, then blurs again. High blood sugar pulls fluid in and out of the lens of your eye, changing its shape day to day. Your focus drifts. People assume they simply need new glasses, and they go get a stronger prescription. Here is the part that surprises them. When blood sugar comes back down, the blur often lifts on its own. So if your eyesight has been strangely inconsistent, that is a signal, not just a trip to the optometrist. Sign number 6. Small cuts and scrapes take too long to heal. A nick on your hand, a scratch on your shin, and 2 weeks later it is still there. Sugar-heavy blood is thick and sluggish, and it does not deliver oxygen and repair crews to a wound the way clean blood does. Think of it as traffic jammed with syrup. Healing is a delivery job, and the deliveries are running late. Sign number 5. Your feet tingle, or feel like pins and needles, or go a little numb. Sugar that stays high, month after month, is hard on the smallest nerves, and the longest nerves in your body run all the way down to your feet. They feel it first. If you have a faint buzzing or a strange numbness in your toes that comes and goes, do not wave it off. That is your nervous system raising its hand. Sign number 4. Frequent infections. Yeast infections, urinary infections, skin infections, gum trouble that keeps coming back. Bacteria and yeast feed on sugar, and when your blood and tissues are sweeter than they should be, you have set a longer table for them. Many people go from doctor to doctor treating one infection after another, never asking the question underneath, why do these keep happening? Sometimes the answer is sugar. Sign number 3, the backwards one I promised you. Dark, velvety patches of skin. They show up on the back of the neck, in the armpits, in the folds of the groin. They look like dirt that will not scrub off, and people try. They scrub, they use lotion, they feel embarrassed. Here is what almost nobody knows. This is not a hygiene problem. It has a name, acanthosis nigricans, and it is one of the clearest skin signs of high insulin there is. When your body is pumping out extra insulin to fight those stiff locks, that insulin tells certain skin cells to multiply and darken, so the patch on your neck is not dirt. It is a window into what your blood sugar has been doing. That is the sign people get backwards every time, and now you will never see it the same way. If you are getting value from this, take 1 second and subscribe to Dr. Hale, and do me a favor. Tell me your age in the comments. I read them, and the ages of the people watching genuinely shape which topics I cover next. All right, 2 signs left, and they are the ones people most often explain away. Sign number 2. You are hungrier than usual, even after a full meal. Remember, your cells are locked out from the fuel. They are starving in a sea of plenty, so they keep sending the hunger signal to the brain, asking for food that is already there but cannot get in. You eat, and an hour later you are back in the kitchen. It feels like a willpower problem. Often, it is a chemistry problem. Sign number 1. Weight that changes without a clear reason. For some people, that is unexplained weight loss, because when the body cannot use sugar for fuel, it starts burning muscle and fat instead, and the number on the scale drops even though nothing about their eating changed. For others, it is stubborn weight gain around the middle, driven by all that extra insulin, which is a storage hormone. Either direction, a real change you cannot explain with your habits, is a reason to check. Now let me tell you about someone. I will call her Nora. She is a composite of many people I have seen, not one real patient. 57 years old. Busy, warm, always doing for everyone but herself. She came in for something small, a rash that would not settle. While we talked, the rest came out. Up twice a night to the bathroom, thirsty all the time. A dark smudge on the back of her neck she was quietly ashamed of and had been hiding under her collar for a year, tired every afternoon. She had explained every single one of those to herself. Age. Heat. Menopause. Not enough sleep. Each explanation was reasonable. Together they were a pattern, and the pattern had a name. We checked her blood sugar. She was squarely in the pre-diabetes range, and here is why I am telling you about Nora, because her story does not end sad. This is the hopeful part I promised you. Prediabetes is one of the few conditions where you are genuinely early, and early means you have power. The CDC and the National Institute of Diabetes and Digestive and Kidney Diseases are clear on this. In this stage, before it becomes diabetes, the process can very often be slowed, stopped, and in many people turned back toward normal. Those stiff locks can loosen. This is not a lifetime sentence handed down. It is a warning light, and warning lights exist so you can act before the engine fails. And we are not guessing about this. The NITC ran one of the most important studies in this whole field, called the Diabetes Prevention Program. They took people who already had prediabetes and split them up. One group made modest, plain changes, a small amount of weight loss and about a half hour of walking most days of the week. Nothing extreme. No boot camp. Over 3 years, that ordinary group cut their risk of prediabetes turning into full diabetes by more than half compared to the group that changed nothing. More than half, from walking and a modest trim. And when they checked back in 10 years later, that group was still less likely to have developed diabetes. That is the payoff waiting for you in this early window, and it is why I never want you to hear the word prediabetes as bad news. It is early news, which is the good kind. I want to be honest with you, because honesty is the whole point of this channel. Everything I listed today can also be caused by other things. Getting up at night can be your bladder. Tingling feet can be a vitamin problem. Fatigue can be 100 things. So do not diagnose yourself from a video. What these 10 signs earn you is a simple, cheap, powerful next step. A blood test. Not a lifestyle overhaul, not a panic, a test. So here is what to do this week. 1. If 2 or more of these signs sound like you, call your doctor and ask for a simple blood sugar test. The 2 common ones are a fasting glucose and an A1C, which shows your average over the last few months. Ask for them by name. 2. Take an honest look at the back of your neck and your armpits in the mirror. If you see those dark velvety patches, mention them specifically. Do not be embarrassed. It is medical information, not a hygiene grade. 3. Start moving after meals. A 10 to 15-minute walk after you eat is one of the simplest ways to help your muscles pull sugar out of the blood without any extra insulin at all. Your muscles are a back door for sugar, and walking opens it. 4. Cut back on the drinks that spike you fastest. Soda, sweet tea, juice, the flavored coffee. Liquid sugar hits the bloodstream almost instantly. This one change alone moves the needle for a lot of people. 5. If you already know you have a family history of diabetes, do not wait for symptoms at all. Get tested this year regardless. Family history is a head start you want to use. Now the clear line I give every patient. This is education, not a diagnosis, and it is not a replacement for your own doctor. I do not know your history or your medications, and there are signs that are not slow and quiet at all. If you are extremely thirsty and urinating constantly, losing weight fast, feeling confused, breathing hard, or noticing a fruity smell on your breath, that is not a wait-and-see situation. That can be dangerously high blood sugar, and it needs a doctor now, today, not next month. But for most people watching, you are earlier than that. You are in the window where it still bends. Nora was. She walked out with a plan, not a prescription for insulin, and a year later her numbers were back in the normal range. Same woman, different path, because she caught the signals instead of explaining them away. Here is the thread I want to leave you with. Today we talked about the sugar in your blood, but there is a second quiet driver that damages those same small nerves in your hands and feet, and it is a vitamin that a large share of older adults do not absorb well, no matter how much they eat. When it runs low, it can feel exactly like the tingling we talked about in sign number 5, and people self-treat it wrong for years. In my next video, I am going to walk you through that one, the tingling and the nutrient behind it, so you know what to watch for. Subscribe so it finds you. Whether you are 43 or 73, you are not too early and you are not too late to get ahead of this. The version of you 5 years from now is watching what you do this week. I am Dr. Hale. Take care of yourself.